Malaria is a disease that has existed for centuries, yet it continues to affect millions of people every year. It is not just a fever, it is a potentially deadly illness spread by a tiny but dangerous creature, the mosquito. Malaria is not transmitted from person to person like the flu. Instead, it is transmitted through the bite of an infected female Anopheles mosquito. A mosquito bites someone who already has malaria and picks up the parasite. Later, it bites another person and injects those parasites into their bloodstream. These parasites travel to the liver, multiply, and then attack the red blood cells. The result is fever, chills, and severe complications if left untreated. Malaria symptoms usually start 1 to 4 weeks after a mosquito bite, but in some cases it can take months. The early symptoms may seem mild but deceptive. These include fever, chills, muscle aches, headache, nausea, and vomiting. However, malaria can also lead to life-threatening complications. Severe malaria can cause severe anemia, where red blood cells are destroyed, leading to pale face and lips, fast heartbeat, fatigue, dizziness, shortness of breath, cold hand and feet. Jaundice can develop, leading to yellowing of the skin and eyes due to liver damage. Organ failure can occur as the disease attacks the kidneys, lungs, and brain. If the parasite reaches the brain, it can cause cerebral malaria, which leads to seizures, coma, and even death. If malaria is not treated quickly, it can become fatal. Since malaria symptoms are similar to those of the flu or dengue fever, proper testing is crucial. The most common tests for malaria include the blood smear test, where a drop of blood is examined under a microscope to check for parasites. Rapid diagnostic tests, or RDTs, detect malaria proteins in the blood within minutes. The polymerase chain reaction test, or PCR test, is a more advanced test that identifies the exact parasite species. A complete blood count, or CBC, can also be done to check for anemia and low platelet levels. Early diagnosis leads to faster recovery and reduces the risk of complications. The good news is that malaria is curable, but only if it is treated in time. Malaria is treated with special medications called antimalarials. The exact medicine depends on the type of malaria and how severe it is. For most uncomplicated cases, doctors use a combination treatment called AT, or artemisinin-based combination therapy. In more serious cases, especially if the person is very ill, treatment may start with an injection or IV medicine like artesunate, followed by oral drugs once they start recovering. Along with medication, supportive care like rest, fluids, and managing fever are also important. Since there is no widely available vaccine, the best defense against malaria is prevention. Preventing malaria begins with avoiding mosquito bites. People should sleep under insecticide-treated bed nets, wear long-sleeved clothing, use mosquito repellents and sprays, stay indoors during peak mosquito hours from dusk to dawn, and use fans and air conditioning. Stopping mosquito breeding is also essential in reducing malaria cases. Stagnant water in buckets, flower pots, and drains should be removed, and gutters and drains should be cleaned to prevent water buildup. Introducing fish in ponds can help as they eat mosquito larvae, and using larvicides and insecticide spraying in high-risk areas is also effective. For travelers, taking preventive medication is crucial when visiting malaria-endemic areas. Anti-malarial pills should be taken before travel, continued during the trip, and even after returning home. In some African countries, the RTS vaccine is available, which helps reduce severe malaria cases, but it does not provide complete protection. Malaria is caused by parasites, not bacteria or viruses, and it spreads through mosquito bites, not from person to person. Prevention is the best strategy. Avoid mosquito bites and take precautions. Malaria can kill, but with the right treatment and prevention, we can win the fight against this deadly disease.